Today, we will discuss the latest guidance on HBA1C targets for adults without pregnancy based on the American Diabetes Association's 2025 Standards of Care. It is important to remember that setting an HbA1c target is a process that involves shared decision-making with the patient. We must consider their overall health status, other medical conditions they have, and the potential risks associated with different treatments, particularly the risk of low blood sugar episodes. Individualization is key in managing blood sugar levels. For a large number of non-pregnant adults, the generally recommended HbA1c goal is less than 7.0%. This level aims to reduce the risk of long-term complications while avoiding excessive treatment burden. In certain adults who are in good health, have good functional status, and where the risks and burdens of treatment are low, a more stringent HbA1c goal may be considered. For this specific group, a target of less than 6.5% is sometimes appropriate. This lower target is pursued when it can be safely achieved. For older adults, HbA1c targets are adjusted based on their health and complexity. For older adults who are generally healthy, a reasonable HbA1c target is typically less than 7.5%. This acknowledges potential differences in life expectancy and risk tolerance compared to younger adults. When managing older adults with more complex medical conditions or intermediate health status, the HbA1c target is further adjusted. For this group, aiming for an HbA1c less than 8.0% is considered reasonable. This higher target helps prioritize safety and quality of life. Finally, for older adults who have very complex health situations or poor overall health, and for any adult with limited life expectancy, a specific HbA1c target is not recommended. In these situations, the primary focus shifts away from achieving a numerical HbA1c goal. Instead, care is focused on preventing symptomatic high blood sugar and, critically, avoiding episodes of low blood sugar. Management aims to maintain comfort and manage symptoms effectively